your cited sources or references. And let me give you an example. One post each thread per day. So that means once I post my initial reply to this discussion thread, I can't reply again until tomorrow, okay? The rubric requires 3 separate posts on 3 separate days. Your first initial post is to the discussion topic. Your second 2 replies will be to your classmates. For example, you can also reply to me. I've already posted my first discussion. To reply to a classmate, scroll down to the bottom of their discussion post and select reply. Let me give you an example of a response to another classmate. For example, I click reply. Not being responsive. Let me try this one. There we go. All right. And so again, it's always good to also address your classmates. So you can say, hi, Erica. Remembering that the patient's left and right side are not the same as the providers in most positions definitely is a great point to make. I also believe that it's important to understand quadrants because when providing care, especially to kids, sometimes the only clue you can get to what is wrong is when the patient feels discomfort. And that's a quality reply, right? And then again, you'll hit reply. If you don't like your reply and you want to edit it or even delete it, come over to the 3 dots on the right-hand side. Select delete or edit. I'm going to delete these. Now let's move on to your assignments in MBC 101. First up is EHR Go. EHR Go is a comprehensive electronic health record software. This software simulates real-world healthcare scenarios. It allows you to practice and apply your billing and your coding skills in realistic hands-on environment. Through EHR Go, you will learn how to navigate patient records, process billing information, and understand the workflow of electronic health systems, preparing you for the demands of the healthcare industry. As part of this assignment, you'll complete an orientation. This is going to familiarize you with the EHR Go system and its features and functionalities. This orientation is crucial for your success in the MBC courses. Again, I've also included some additional videos that I recommend prior to accessing the assignment link. There's a video that will provide you a full walkthrough of EHR Go section by section. And you can be logged in to EHR Go and explore this while you're reviewing the video. I'll show you how. I also provided a YouTube video that does a short demonstration, not a complete demonstration, but a short synopsis of how to complete the EHR Go orientation assignment. Now, having said all that, before you can access this assignment and any future EHR Go assignments, you'll need to subscribe to EHR Go. In order to create an account, you'll want to select the link that I supplied you. When you click it, You're going to come over in the upper right-hand corner and select subscribe. It's then going to prompt you for a program key. The program key is included in your assignment. You can free type it or just copy and paste it. And then you'll select validate program key. Next, you'll be prompted to fill in your information: first name, last name, phone number, the campus, so just your base campus, and then provide contact address. I recommend using the student assigned email address, and then create a username and password, and then confirm your password. And then finally create your account. And that's it. Once you've created your account, then you'll go back to your assignment. And click on the week 1 assignment link. Links will be assigned to you. So without an assigned link, you would not be able to access your access to EHR Go material is limited to just the orientation. I'm going to go into student view, review the activity description, and then I'm going to show you how to access the resources to complete this week 1 assignment. So notice you got 3 tabs up here at the top: Overview and Resources, Launch EHR, and Download Your Work. Scroll down to the bottom of the first tab. This is where you'll find your resource. Click the blue button to download your resource. If you're using an iPad, when you select download, it's going to download this to your download or to your files. So just be sure to remember what the name of the resource document is or the file is, so it's easily accessible to you. I've downloaded the resource. It provides you complete instructions. In this orientation, you will review the chart of Jane Shriver. Click on Launch EHR to review the patient chart to begin this activity. Refer to the patient chart and any suggested resources to complete the activity. In this particular scenario, you won't have to download work and save a progress report. You're going to type directly on this orientation, and I'll show you how. So again, I walk you through each step. So step 1, overview and resources, is always the first step to complete an EHR Go activity. Step 2 would be launching EHR. And then it walks you through each section. Getting started. Once you launch the EHR and click New Session, this will open up the EHR. Follow the instructions and then answer the questions. For example, how old is Jane Shriver? It shows us right here in the patient header that Jane Shriver is 76 years old. I'll also show you where that's located within the actual account. So again, just a demonstration, you would type 76. What is her medical record number? Up here, you're going to see MR and a pound sign. That stands for medical record number. So here, you would type in K34-9800. And then again, just review each section. It's going to take you to a different section, and then they're going to ask you 2 questions or 2 or more questions. And it also, again, provides you demonstrations of what you should be seeing on your screen. I'm going to split my screen here. If you're working from an iPad, in order to split your screen, you're going to look at the top of your screen on your iPad and look for 3 dots in the center of the screen. Tap those 3 dots, and it's going to give you an option of full screen, slide over, or split screen. Split your screen, and then you'll be able to simultaneously see the assignment you're working on and the document or your resource document. Next up, after the resource document is acquired, is launching your EHR. Click Launch EHR and then select New Session. You can access this assignment as many times as you like. It is not timed. Again, the requirement is just for you to have all the questions answered and submitted by Sunday, August 25th, midnight. So you can come in, log in, answer a couple of questions, save your work always, okay? It won't automatically save, so make sure that you come up to the top of your Word document, your resource document up here in the left-hand corner. Notice how you have the option of autosave. That's one good thing to do, is just always turn on your resources or whatever you're working on. Good habit to get into is always have autosave on. And then notice how my first option to save my document is to OneDrive. That is the same thing that you want to do. You're going to want to save this, especially students that are working from an iPad. Everything will be saved to your OneDrive. Everything you're going to access from your OneDrive. So files, downloads, whatever it is, everything is saved to what they call the cloud, which is your OneDrive. I don't want to save this document. And again, I want to quickly just walk you through. There are some tutorials. In order to expand the account section, scroll down to the bottom and then click the wheel, and then additional tabs will populate. Okay. And again, plenty of resources for you. Quick tutorials, walkthroughs through EHR. Again, recommended so you guys are comfortable when accessing these medical records. This is a big part of what we do every single day as billers. Now, I wanted to show you how you could also, split screen. You could watch the video on the EHR Go tabs overview while you have your EHR open. Again, I post a lot of YouTube videos, self-made and some directly from trusted sources on YouTube. Take the time to review those weekly. All right, moving on to your next E8 or your next MBC 101 assignment. So I'm going to go back to modules. We've covered weekly readings, discussion activities. Again, keep in mind anything that has points assigned to it has a deadline, due dates, and your discussion activities have to be initiated, all first threads initiated by Wednesday of each week. And then you've got 2 additional assignments due in week 1 for your MBC 101 course. Medical terminology, click on it. It is a timed quiz. You will have 2 attempts, and the correct answers will always be revealed after your last attempt. It does have a time limit of 120 minutes. Again, I'm not in student view because these assignments are currently locked, but you will see on your screen as a student a blue button where it says it gives you the option to start the assignment. Once you start the assignment, then the clock starts to tick, okay? So just again, whenever you're accessing these timed quizzes, just be sure that you're ready and sitting in a prepared, distraction-free environment that isn't going to pull you away from what your goal or what you're working on in that moment. Some of these exams are one attempt only, and I don't want you to, miss out on any time available to you. Let's see if I can preview this assignment. There we go. So this is what it's going to look like for you as a student. Once you access the quiz, then you're going to see that there is some true and false questions and then some matching, match the suffix choices. All right. Let me go back to modules. Last assignment. This one's worth 44 points. This is also a matching vocabulary quiz, but it's specific to radiology. And again, you'll be matching the right term, right definition to the right term. Okay? And then you'll hit submit quiz once it's completed. This quiz has 2 attempts and again has a time limit of 120 minutes. All right, and that's it. That is a complete walkthrough of your week 1 assignments from both course shells, MBC 10 and MBC 101. All assignments are available as of Sunday, August 18th, and then all the way through Sunday, midnight, August 25th. Pace yourself, take your time. I definitely recommend getting in there, get invested in your readings, take a look at my weekly announcements as well. I have announcements on discussion posts, academic integrity and plagiarism, putting it all together, medical terminology. This is where you'll find your Canvas course tutorials, student success tips. And what you'll also find is weekly, I will be adding an announcement, and each week it'll be titled Week 1 resources, Week 2 resources, Week 3 resources, Week 4, Week 5, Week 6. And each week I will add additional resources, demonstration videos that will, again, support you in the material that's been introduced to you for that week. For week 1, this is the title of the announcement. Welcome MBC students to week 1. I am currently in the middle of my demo video walking you through the assignments. So after I complete this video, that will be added to this announcement. I also am open to suggestions to enhance your learning experience, to provide you with the tools to work independently. So you can always click reply down here and you can put in a request for a specific demonstration. Just let me know what your needs are. All right, class, I will see you in the next episode.